Hello. The topic that I wanted to talk about today was the type of sonography positions or types of jobs that there is. So once you're a sonographer, as you're going through your schooling process, you can kind of decipher what you really enjoy and as you're going through your clinical rotations. I loved working with children, but I felt like it was difficult for me to see them hurting. It was hard. So I knew that I couldn't do that for me personally. Also, I didn't really care for doing breast stuff. I may have some, but that was just not my favorite thing to do. So I will do it, but it's just not my favorite cup of tea. To be honest, I like doing a little bit of everything. So I'm kind of a general sonographer. So with that being said, there's many different paths that you can take. Once you're going through, you can kind of decipher, okay, if I'm going to a children's hospital, you're going to be considered more of a pediatric sonographer. If you work at a breast center, you can then focus on just being a breast sonographer, focusing just on breast, which breast itself is a whole planet on its own. There's vascular specialties, so you can just work in a vascular office where they do venous insufficiencies, DVTs, and doing all the vascular, arterial, venous, and all that kind of good stuff. A general sonographer is great. Usually you can work in a clinic or the hospital setting where you get a little bit of everything, which is like my favorite because I don't want to just do babies or just do this or just do that. I want to do a little bit of everything. Keeps that variety going. Vascular, pediatric, breast, general. Let's see, cardiac. Let's see, did I hit them all? I think I did. But just know there's a variety of things that you can do. It just depends on the path that you want to take. If you're working at an outpatient center, usually it's like an 8 to 5 type of thing, whereas a hospital setting, the patients don't go away typically. It's open 24/7, so there may be call, there may be different hours and things that you may need to do. Just a little bit different stuff. Figure out what you want to do, what you like best, and how you feel like you want to help patients, because it's not just baby ultrasounds. There's a whole variety of paths that you can take.